Humans have developed treatments and vaccines against several diseases and infections. However, you must have heard about a health condition such as AIDS for which a cure does not exist. AIDS is caused by a virus called HIV. It is mainly transmitted by the unprotected sexual intercourse with multiple partners. Like AIDS, several other infections are transmitted through sexual intercourse. But how does the sexual intercourse spread these infections? In this video, we will be dealing with these infections as well as infertility. The diseases or infections that are spread by sexual contact are called sexually transmitted diseases. These are also called venereal diseases or VD or reproductive tract infections or RTI. Some examples of STDs are gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, and AIDS. In addition to the sexual intercourse, AIDS and hepatitis B can also occur in children born of infected mothers and also to those infants breastfed by an infected mother. The infection is also spread by practices involving the exchange of blood and body fluids between people, such as blood transfusion and sharing of infected needles and surgical instruments, and as a result of an unprotected sex too. STDs other than hepatitis B, AIDS and genital herpes are curable if diagnosed at early stages. The early symptoms of most STDs are pain, swelling, and fluid discharge in the genital regions. The common complications associated with STDs are stillbirth, natural abortions, pelvic inflammatory diseases, infertility, and genital cancers. STDs are more prevalent among the individuals of the age group 15 to 24 years. And these infections can be prevented by the following simple measures. And they are to avoid sex with unknown and multiple partners, using physical barriers such as condoms during sexual intercourse, and consulting doctor in case of any symptoms to avoid any further complications. Having talked about infections acquired by sexual intercourse, let's discuss another complication associated with the reproductive health. Do you know Lucy Joy Brown, the world's first IVF baby born in a lab in 1978? IVF is one of the several special techniques that allows infertile couples to have children. So let's talk about these techniques in more detail. Assisted reproductive technologies or ART, are the techniques used by the infertile couples to have babies. Infertility is when couples fail to have babies despite having unprotected sexual intercourse. In vitro fertilization is a fertilization of the sperm and the ovum outside the body in the laboratory under stimulated conditions. This is followed by an embryo transfer or the ET, which includes ZIFT and IUT. Irrespective of the technique followed for embryo transfer, the babies developed by IVF are called test tube babies since fertilization occurs in laboratory glasswares. Zygote intrafallopian transfer or the ZIFT is a technique by which the zygote in an 8-celled stage is transferred into the fallopian tube for implantation and further development. Next is the intrauterine transfer or the IUT. It includes the transfer of an embryo with more than 8 blastomeres into the uterus to facilitate further embryonic development. Gamete intra-fallopian transfer or GIFT is useful when infertility is due to high acidity or inadequate mucus of the female reproductive tract. Here, the ovum from the donor is introduced into the fallopian tube of another female who is unable to produce ovum but has the reproductive tract suitable for fertilization and embryonic development. Intracytoplasmic sperm injection (ICSI) is followed when the infertility is mainly due to reduced sperm motility. In this procedure, the sperm is directly injected into the ovum in lab conditions and the zygote of the 8 or 16 cell stage is injected into the uterus for implantation and further growth. When infertility is due to low sperm count in the male partner, artificial insemination is done. So what is artificial insemination? Artificial insemination or AI is the introduction of sperms from a healthy donor with a good sperm count or the partner into the female reproductive tract artificially. Intrauterine insemination or IUI is another method in which sperms from the donor are directly placed in the uterus rather than in the vagina. So, let us summarize what we have learned.
Manorama Horizon. Learning made simple.